This is the sole survivor from a parcel that I received last night. And I haven't named it. Let's go ahead and weigh in. 10 grams, he was 9 grams last night. He was well hydrated last night. Yeah, he had sub-Q fluids and then several fluid feedings, and now he's on diluted formula. He is peeing and pooping a little bit. Active, so I'm hopeful. My 4 grammars are doing well. Okay, I have a tiny adapted umbilical cath. There's also a harder one, harder type of a catheter. You have a different type of plastic if you're having trouble getting the tube in. You support the baby's head with 3 fingers and the rest of its body with the rest of your hand. I always keep it covered either with fleece or with at least paper towel to hold in a little bit of heat while you're doing this. The only part of the baby's mouth that's open is right there at the very tip, about the size of this cannula. So we're going to put it there and apply very gentle pressure. This is really soft and it collapses upon itself really easily. So sometimes I use this, and sometimes with the babies I also use the other harder one because it's easier to get in the mouth. But once it's in the mouth, just a little bit, I'll express just a drop of formula. And once the baby tastes that, it'll usually allow you to get in. If it goes down easily, there's my mark. I've marked from the nose down to the stomach. And you can just put it right in and then very gently give it its 5 to 7%. What I do is I look until I see a nice milk band. I don't know if you can see that. Let me turn this off a second, see if I can get a better lighting. So, can you see the little white area? Little band of milk that goes across there. As soon as that band is complete, it doesn't have to be super thick, but as soon as it's complete, you're done for that feed. And then continue to let it, hear it chirping? Now at this age, the esophagus and trachea are totally separate organs and pathways. See, that's so you can see how long it is. And with the harder ones, let me put this baby in to keep it warm. I'll put it in a little bag and put it in my bra for right now. I'm going to show you the other type of tube that you can use for these very tiny ones. This one, these come in pink and purple, but you can see it's a clear plastic tube. Very thin. I'll compare the two for you. See how this one is very, very flexible? This one is almost, not quite as flexible. It feels almost like a light fishing line, even though it's hollow inside. This, I am really, really careful with this one because it's not quite as flexible, and so I'll usually only go in about that much in tinies. I call it non-invasive feeding because the tube is in about as much as the mom's teat is, which goes back to the oropharynx, the area between the mouth and where it goes down into the gut. Even this is soft, even though it's relatively soft, this can pierce that membrane, those fragile tissues. If it happens to hit straight and not curve down. This one, you don't have to worry about it really because it's so soft, it's going to curve. But sometimes it's also a little bit more difficult to get in because it collapses when you're trying to push it in the mouth hole. So this one goes in the mouth easier. I only take it down about a centimeter and a half. This one can either go to the back of the oropharynx, or if the baby's going to be swallowing, you can pre-mark where the length would be to just enter to the gastrum. This one is actually marked for a 15-gram baby, so the 10-gram baby is really, it's only going down that far, which is 3 centimeters, so about twice as far. Babies get between 5 and 7% of their body weight. 5% is always easiest, but if you see they're not gaining, then you can up it to a 7%.